Hi, my name is Nancy Ashby. I'm a family nurse practitioner with Regenerate Scottsdale, now found inside of Olson Chiropractic Wellness Center. I am a BioTE Hormone certified provider, and I'm so glad you could join us today to learn more about this important topic. Today, we're going to talk about hormones and how something so small can make a big difference. But before we get into it, I'd like to address something. Some of you may be wondering, why are we talking about hormones at a time like this? Let me be clear. Hormones affect your immune system. So when your hormones are imbalanced, your body is not able to protect you as well against any viral or any other immune system attacks. Are your hormones wreaking havoc? Do you know what your hormones are responsible for in your body? How do you tell if you have an imbalance? We're going to talk about what you need to know, what hormones are and their basic functions, and what you can do about it, what treatment options are available, and what we're offering here at Regenerate Scottsdale. So let's get started. Oftentimes, when we think of hormones, we tend to only think about their role in our reproduction. I've already mentioned that hormones affect your immune system, but did you know that hormones also affect your sleep, your heart rate, the amount of stress and inflammation you have circulating in your body, your digestion, and even your hair production? These are just a few examples of the things hormones are responsible for controlling. A question I have for you is, do you think that we age because we lose our hormones, or do we lose our hormones because we age? If you guess the first statement, you're correct. We age because our hormones decline. So let's see how we can age healthy. As I mentioned, your hormones are responsible for controlling many body functions, and when they're imbalanced, your body can be too. Things like extreme fatigue, mood swings, anxiety, tension and irritability, lack of sleep, memory loss, depression, lack of focus and brain fog, hot flashes and night sweats, weight gain, joint pain, bladder symptoms, migraine or severe headache, and decreased sex drive and performance are many of the symptoms you can have with hormone imbalance. Do any of these sound familiar to you? To help combat these common complaints and hormone imbalances, our office has chosen to partner with BioTE Medical to offer hormone balancing treatment. We feel this was the next natural progression of services to add to help our patients age healthier. So before we get into too much detail about that partnership and treatments, I want to talk a little bit more about hormones. Let's start with testosterone. Testosterone matters. Let me say that again. Testosterone matters. Testosterone is not just a male hormone. It's found in both men and women and can cause a lot of havoc when it's imbalanced. In men, low testosterone leads to what is often referred to as male menopause or menopause in the community. We like to refer to it as andropause in medicine. 20% of males over 50 have low testosterone. It's common in men with diabetes, high blood pressure, high cholesterol, sleep apnea, obesity, depression, and erectile dysfunction. It's linked to early heart disease, Alzheimer's disease, and prostate cancer, and it is highly underdiagnosed. So let's talk about estrogen. Again, this hormone is primarily found in women, but men do have some healthy amounts of estrogen as well. In women, low estrogen leads to the dreaded menopause. Menopause is unavoidable. All women will go through menopause. It's the natural decline of our hormones. In fact, 3,500 women enter menopause daily, but with that comes all kinds of symptoms, and those symptoms can begin up to 15 years earlier than expected. Menopause is more than just the well-known hot flashes. Most women are affected in more ways than they realize. Menopause is fatigue. Menopause is unexplained weight gain and difficulty losing weight. Menopause is moodiness, depression, vaginal dryness, and decreased sexual interest. Menopause is not something you go through. Most women do not ever get over or get through menopause completely where they don't have any symptoms. One thing we don't talk about often is that menopause is also increased heart disease risk. Recent research has suggested that women are at an increased risk for heart disease over men, and it's because of the decline in our hormones. The numbers don't lie. 1 in 7 premenopausal women die from heart disease, but that number rises to 1 in 3 postmenopausal women who die from heart disease. That's not a they have it number, that's a death number. Menopause is unavoidable without treatment. So what happens when your testosterone and estrogen levels are where they should be and balanced? Well, patients often report increased energy, vitality, and zest for life, improved feeling of overall well-being, increased libido and performance, control of hot flashes, improved skin, relief from depression and anxiety, improved cognition with clarity, memory, and focus, lower cholesterol numbers because we increase the good fats, improved bone density, and reduced body fat and weight loss. Research supports these findings and shows us that balanced hormone levels provide breast protection, prostate protection, brain protection, heart protection, and bone protection. Who doesn't want these things? So what can you do to help alleviate any of these symptoms of imbalance and get the benefits of having balanced hormones? Hormone optimization is the answer. Hormone optimization is not just any hormone replacement therapy. It is individualized, safe, and effective. We do this through the use of bioidentical hormone pellets. Bioidentical hormone pellets are natural and plant-derived, meaning that they have the same structure and functionality as human hormones. Traditional hormone replacement therapies are just the opposite of these. They're made from horse urine. They're given in generalized dosing, meaning that they don't take into account an individual's needs, and they've been shown to increase the risk of cardiovascular events because of their synthetic structure. Now, I know what some of you may be thinking, but what about other forms of bioidentical hormone replacement, like creams or patches or lozenges or troches? There's a lot of options out there. Bioidentical hormone pellets have an advantage over these other forms because of their ease of use and steady distribution of hormones. Pellets are as small as a seed and up to as long as a grain of rice. They're placed under the skin, most often in the bottom, and provide a steady stream of hormones into the bloodstream for about 4 to 6 months. There's no creams or patches to be applied or pills to be taken multiple times a day. Unlike with creams, there's no risk that your body won't absorb them because they are regulated by your heart rate and bloodstream. This is why, unlike pills and patches, there's no peaks and valleys in your symptoms, just steady relief and protection from those chronic diseases. So how do we know what dose is right for you? Well, it all starts with an assessment of your symptoms and a blood test. We check a comprehensive panel of lab tests, including checking your hormones, that helps us determine what treatment is best for you. But we don't just look at your reproductive hormones. We look at thyroid hormone and function, we look at vitamin D levels, cholesterol levels, and several other metabolic and immune function panels. We carefully look at these results in conjunction with your symptoms because sometimes low normal results may not be optimal. We do this to give you the best recommendations for your overall health and well-being. These lab tests can be submitted to your insurance, and if you don't have insurance, we have a very reasonable cash pricing available from our partners. So, in summary, hormone imbalances can occur in men and women at any age. Not all therapies are equal. Hormone balance is not a one-size-fits-all approach. You want to make sure you go to a certified BioTE provider. Low normal labs may not be optimal, and it's time to get tested. If you or someone you know would benefit from this, please call our office at 480-314-2262 to schedule a free consultation. I want to thank you for joining me today, and I hope to hear from you soon.